Hi, my name is Mark Scotch, and I'm going to be speaking about the Kidney Deaths Act, H.R. 2687. That's House Resolution 2687. A little bit about myself. I'm married to my wife, Lynn. We are both retired and we live in Wisconsin. We have 3 grown sons and 3 grandchildren. We both donated our kidney to strangers. I donated in 2020 and Lynn donated in 2023. I donated at age 64 and Lynn donated at age 66. I also donated a portion of my liver at age 67 in 2023. And the Oregon Trail is something we started 5 years ago. And it's a series of bicycle rides all across the United States. I've ridden over 10,000 miles by bicycle with 1 kidney. We've gone through 23 states. We've had over 300 interviews, with the highlight being the Today Show in 2023. And I'll be bringing this up later. The Kidney Deaths Act is a 10-year pilot program to provide a refundable tax credit of $10,000 per year for 5 years, a total of $50,000, to anyone who donates a kidney to a stranger. This will go to people who have been on the wait list the longest, and will go to the best match for their kidney. This will save up to 100,000 American lives and $40 billion over the 10 years. Back in 1972, President Nixon signed legislation that established Medicare coverage for end-stage renal disease, ESRD, patients. And it aimed to improve access to dialysis and kidney transplant services. Also included all their drugs that they need to take, immunosuppressant drugs. And this is critical because today, more than 50 years later, most, if not all, people are on Medicare who are on dialysis and seeking a transplant, whether from a deceased donor or a living donor. Then in 1984, Congress, with the lead of Senator Al Gore, established NOTA, National Organ Transplant Act. And there's a number of things that it established, but one of the main things was it prevented the sale of organs. And it ceased all black market activities. There was some things going on to both donors and recipients. And it mandates the creation of a national registry for organ donors, which is huge. That's still going on today. And encourage public awareness for campaigns about organ donation, and sets guidelines for ethical practices in organ transplant. So being evaluated as a living kidney donor is very intensive, and it has extensive requirements. Today's situation. The Kidney Deaths Act is designed to end the kidney shortage. We hope to save 10,000 lives and save Medicare $4 billion annually over the life of the bill. 94,000 Americans currently are waiting for a kidney transplant. Almost 10,000 die every year waiting, about 25 every day. That's 13 on the current wait list and 12 who are too sick to get a kidney transplant and are moved off the list. 25 die every day, like I said. Dialysis costs $50 billion annually. It's about 1% of the federal budget, or $100,000 per patient per year. The facts. Donor safety protocols will remain unchanged with the End Kidney Deaths Act. Only donors passing rigorous medical and physical social screening qualify. These standards remain among the strictest in modern medicine. And why is there such a shortage? Well, we can't do much with deceased donation except have more people sign up on their driver's license and such to become donors if something should happen. So that remains that the living donors have to pick up the slack. Only about 2% of willing donors qualify and donate due to strict screening. You just can't walk in and say, hey, I want to become a living kidney donor. That just doesn't work. Over the past 25 years, and this is critical, it ties into the Oregon Trail and my efforts over the last 5 years, deceased donations have increased to 200%. We medically can remove organs from patients and get them to needed people who need a transplant. But living donation has increased 0%, which means over the last 20 years, we get about the same amount of living donors that come forward, right around 6,000. We have not increased that number much over 6,000 in the last 20 years per year. Nearly 1 million Americans are in kidney failure. Low-income patients are 3 times more likely to die from kidney disease, and we're hoping that the End Kidney Deaths Act will rectify that. What's the bottom line of the End Kidney Deaths Act? Hope. So many people are losing hope because they will never get a living transplant, and they'll end up dying on the wait list. Again, 25 people per day. To review the current situation, again, for the last 20 years, the number of kidney donors hasn't changed, roughly about 6,000 a year. All the volunteers, paid staff, private and public organizations, government organizations haven't increased the amount of living donors over the 6,000, 6,600 per year. And I've experienced this via the Oregon Trail. Many other people that have organizations experience the same thing. We are just not moving the needle. We don't know what else to do. We think the End Kidney Deaths Act could be something that will move the needle. We feel the End Kidney Deaths Act will be that needle mover. We ask you to go to the website, endkidneydeathsact.org. You'll find a lot of information there, and we hope you review the website and share it with your family. Right now, we have 48 members of Congress and the House that have co-sponsored the bill. We have many organizations. Thousands of Americans are supporting us. We need people to urge Congress to get on board with this to help save 10,000 lives and $4 billion in taxes every year. We need your help. We're going to Washington, D.C. We're talking to the legislators directly or their staff, and we're hoping to persuade them to consider the bill. But we still need more people to help us. One of the things, again, is to go to the website, especially if you're on dialysis, if you have end-stage renal disease, if you have family or friends who need help, who are looking for a transplant, please sign the petition. And what that'll do is you'll become our constituent, well, we'll be your constituent proxy. When we go into these meetings and talk to legislators, whether it's in the House or the Senate, we'll have your names because you signed the petition. They'll see directly that you're behind the bill, and we'll be speaking for you to help sign this bill to help save lives. So again, please go to the website. This is an example of the petition right here. Just read it, and if you agree with our mission, sign it, and you'll be part of our group. Basically, you'll be there with us when we're speaking to your legislators. It's critical. You can make a difference. This is an example on a website where a person is just giving up. They've decided to stop dialysis, and eventually, within a few days, a week, they'll die. It's just too much. And this is a page called I Hate Dialysis. You can make a difference by going to these pages and encouraging these people to hang on just a little bit longer, especially if you yourself have end-stage renal disease. Help us to bring change. This is that website. There's 57,000 people on this Facebook page. If we can get a portion of them to sign the petition, that would be huge. Thank you so much. And again, endkidneydeathsact.org. Take care.